So now we're gonna do a manual radial pulse, and I'm also gonna count respirations. So when we're doing pulse and respirations, I don't wanna tell my patient that I'm watching them breathe because most people will either start to hold their breath or breathe the way they think that they should. So basically, while I'm counting her pulse, I'm gonna have my fingers on her wrist. Once I've finished with that, I'm not gonna say anything to her. I'm just going to start watching her respirations. So to count respirations, I wanna watch for her chest rise and fall. One inspiration and one expiration equals one respiration. So for the radial pulse, what I'm gonna do is first identify that pulse. So the radial pulse is gonna be thumb side of the hand, directly in the wrist at that flexor point. So I'm gonna place my fingers here. I'm gonna apply some pressure and then kind of loosen it up just a little bit. I'm using the pads of 2 to 3 fingers. Once I've identified this pulse, I wanna note the characteristics of it. So she's about a 1+, so a little bit faint. And it is regular. So if I have a regular radial pulse, I can count for 30 seconds and then multiply by 2 for beats per minute. If her pulse is irregular, then I'm gonna have to count for the whole 60 seconds. Same thing with respirations. If she is breathing at a regular interval, then I can count for 30 seconds and multiply by 2. If her breathing is irregular, I do have to count for the full minute to get breaths per minute. So I'm going to start my timer. Okay, so I got 38. I'm gonna multiply that by 2, so that is 76. Okay, so if I were working with a regular patient, I would not say that out loud, but now I'm gonna start counting her respirations. Okay, so I got 7 multiplied by 2, that's gonna be 14 breaths per minute.